My name is Mark Nyachieo. I'm an occupational therapist, currently based here in the Karen Hospital. And occupational therapy is a branch of healthcare services, which is in the Department of Physical Medicine. And in physical medicine, we focus on function. So occupational therapy, we focus on conditions which interfere with either function or conditions which may affect in your daily life functioning. So we have a category of clients who need occupational therapy. In children, we have conditions which interfere with their play or their schooling. And in these conditions include autism, which is a spectrum of disorders. We have what we call developmental delay, just because of cerebral palsy. We have those with path-related injuries. We call it Erb's palsy. We have those children with learning disabilities. We call them attention deficit hyperactive disorders. We have those with other developmental deficits like rickets. We have children with Down syndrome. We also have conditions like birth-related deformities. So in these conditions, they have specific deficit in terms of functioning, which is interfering with their learning or in their schooling. So for a parent or who has not maybe got a diagnosis, you need to check out in terms of development, what is your child not able to do compared to the peers, maybe sitting, crawling, communication, identifying you, and that social smile. So you check out on those. In terms of behavior, are they hyperactive? Are they concentrating? You compare with the peers, because we have what we call developmental growth and chronological growth. So in terms of chronological, we are saying at 6 months, for example, a child should be able to sit with support. So if your child is not able to sit with support, that is an indicator that this is a child who needs early intervention and early screening. And even if we are talking about communication and development of that social smile, being able to identify familiar people around that child. So those are some of the red flags you have to really identify at that level. So in occupational therapy, we talking about sensory integration. This is a tunnel. It's for motor planning, coordination, concentration, and for following instructions. A child go through there, and there's what we call repetition to enhance that skill. We have the trampoline for vestibular and proprioceptive stimulation, and that ball. Then we have what we call activities to enhance fine motor skills, concentration, coordination, eye-hand coordination, and following instruction and repetition. Then we talk about hand therapy. Here involves the grasp patterns, prehension patterns, the ability to control that movement, and the precision of that movement. When you're talking about cognitive therapy, here is matching these objects into this. This requires a lot of coordination, problem solving, judgment, and repetition for that kind of skill to be enhanced. When talking about developmental milestones, sitting is a developmental, gross motor developmental skill. And when you place the child here for this kind of activity and you give him this to march and repeat this activity to enhance that kind of skill. The same to do with the standing, it's adjustable to fit the client size. The same to do with the stairs, which involves up and down steps making. Then we mentioned about leisure. Leisure involves activities which someone does for enjoyment and to relieve himself. So Scrabble is one of it, Monopoly is another one. We also have all the various leisure choices depending on the patient's need, depending on their ability to do that activity and their previous interests. So we also have this for coordination, eye-hand coordination and bilateral use of activities. For example, use of hands, that ability to figure out which movement needs to be done and at what level. Then we have this, which requires that fine motor coordination, concentration, and repetition, so that you enhance that skill while doing the activity.